Hi there, my name is Mylin. I'm a registered practical nurse. In this short presentation, I hope you feel a little less overwhelmed and a little more confident with your choice in continuous cycling peritoneal dialysis. My goal is to educate you on what to expect before and after surgery and how to care for your Tankoff catheter. By the end of the video, you will be able to identify the importance of having and caring for a catheter and your responsibilities before and after your catheter insertion procedure. Automated PD is a flexible and individualized treatment that is structured around your health and lifestyle needs. Those who work, study, have hobbies, children, or if you're an older person who relies on a caretaker, this treatment is beneficial as it can keep you free during the day. The preparation time for the treatment is short, and the dialysis takes place while you sleep. You and your carer can prepare the machine, connect you at bedtime, and disconnect the following morning. Your perfect PD catheter will provide reliable and rapid inflow and outflow from your peritoneal cavity without leaks or infection. There are variations in design of catheters that include the number of Dacron cuffs. Catheters can be bent or straight at the intramural segment and straight or curled at the intraperitoneal portion. The most widely used catheter would be the Tankoff catheter. We will be focusing on the curled Tankoff because patients have reported that it is more comfortable. There's no difference in infectious complications between the straight or curled Tankoff catheter, and patients have reported minimal catheter movement, and the curly end makes the rate of fluid inflow more comfortable when compared to the straight Tankoff catheter. So as you can see from the diagram, to the very left side, that would be our external segment. So this piece connects to the solution via transfer set using an adapter. And then in the middle, you have your intramural segment. So this piece has something called the Dacron cuffs, what I mentioned earlier. So these cuffs are actually spaced at about 8 centimeters apart, and this segment will actually minimize leaking of your dialysate, and it prevents bacteria from entering the catheter. So these cuffs, there's going to be one closest to you that is implanted in your peritoneal space, and this would hold the catheter in place. The second cuff would be in the subcutaneous tissues, so like near your skin almost, and this would act as a barrier to prevent infection. So the last piece is called the intraperitoneal or internal segment, which is to your far right there, and you'll notice that this piece actually has many small holes up the side, and it sits inside your peritoneal cavity, and this is for the in and out flow of solution. So catheters are flexible. They're actually made of silicone tubes with an open end port with several side holes for drainage and absorption of the dialysate. There are a few advantages, which is overall quality of life, more energy, the possibility of traveling and continuing to work, and a few disadvantages would be infection at the exit site in the tunnel. And although peritoneal dialysis is a wonderful treatment, sometimes it won't be able to remove all of your toxins. So that would lead to hypercatabolism. And the last disadvantage would be it could cause an opening between your peritoneal and your pleural cavities. So to prepare together, we would actually discuss your lifestyle, your work, your hobbies, anything that happens in your life and that's important to you. It will be taken into consideration when we are deciding where to place the catheter. We also want it in an area above or below your belt line, whichever you prefer, as long as you can effectively complete exit site care, which we will discuss later in this video. So with a skin marker, we will clearly mark your exit site. So in the pre-operation stage, there will always be a standard for preoperative practices, like coming in with an empty bladder and bowel. Any constipation needs to be resolved. Clean skin and hygiene is important as well, so a shower or a nice bath on the morning of operation is necessary, and any abdominal hair that's there needs to be shaved. So before your operation, we will screen you for Staphylococcus aureus, which is a type of bacteria that could potentially increase the risk of infection to your catheter exit site, and it could cause other infections like peritonitis. Evidently, antibiotics are administered at the time of catheter insertion to prevent catheter infection and peritonitis. So the last but most important pre-op stage would be assessing your mental health, which is your psychological preparation. So this is a huge turn in your life, and you're here watching and you're going to consider the advantages and disadvantages, so you have the intention to take action in the near future. And by watching this video, you are taking a small, healthy step towards self-care. Catheter insertion. So catheters are actually easily inserted under general anesthetic. Your peritoneal dialysis nurse will complete your pre-op assessment and will accompany you to your procedure to ensure the catheter is functioning well before final wound closure is made. Radiologists can insert a catheter using an X-ray-like machine to perform the procedure, and those with previous abdominal surgery, laparoscopic or open insertion can be done as well, which is basically it's a scope that's done by examining the internal organs inside, which is also a low-risk procedure. So post-op, your goals of post-op operation catheter care is to 1, minimize any bacteria of the exit site. Number 2, prevent trauma to the exit site by immobilization of the catheter. 3, minimize abdominal pressure to prevent leakage. And 4, prevent infection. So there are key elements of chronic exit site care recommendations. For 1, you should be washing your hands before touching the catheter or exit site. You can definitely use any antibacterial soap to clean the exit site, and a clean washcloth and towel can be used for the healed exit site. No need for a gauze. Non-sterile dressings can be used to cover the healed exit site. The catheter should be immobilized at all times to prevent any trauma. And you are not allowed to swim in any lake, river, stream, bathtub, hot tub, just because of the high bacterial counts in them. But you can swim in chlorinated swimming pools, and the ocean is allowed if the site is only healed. Exit site care should be done after swimming in the ocean or a chlorinated pool. So you, as the patient, and my responsibility as a nurse is to monitor for any warmth, swelling, or redness at the site. Monitor any discharge, anything yucky that comes from the site, and record the color, amount, and smell, and note if there's any bleeding. Make note if there's any pain at the site when you touch that area as well. Definitely recommend to not remove any scabs or crusts, no scratching at the site. I discourage any activities that include tension, tugging, twisting, or pressure on the exit site. Avoid aggressive cleaning of the site, and remember that the catheter must be immobilized. And always remember, practice good hygiene and always wash your hands.